Now I have no audio. Why do I have no audio?
Hi, can you hear me?
Oh, now I can.
No, I've been here. I just had myself on mute.
Okay, I wasn't hearing anybody else at all, so I thought, well, maybe I didn't have any. I was just getting ready to try to call in by phone. So I see we're getting some people on. Karen, can you hear? I'm just checking, doing sound check. I see Jill from Yukon.
I can hear you.
Okay, good. Okay. People are just muting themselves, which is fine. Yeah. All right. So let's see. Clifton, I need to... do you want me to go ahead and change to you? Let's see here. Maybe I'll wait and, well, I could go ahead and do that. There's no reason not to. Let's see. Change presenter and share. I don't need to do that. Okay. Uh-oh. There we go. Okay. So Clifton, whenever you're ready to switch over to your screen.
So I have 3 screens, and I'm trying to figure out which screen I need to show.
Okay, so I see Catherine from Stillwater. Okay, great. Let's see who all we have. Oh, there we go. I see you. That's working. Okay.
Okay, so I am ready, and I will just sort of sit back until you tell me to start, Becky.
Okay, yeah, we usually wait a few minutes, give people a chance to get on. So All right, everybody, I think I will go ahead and just do a few brief updates and then turn it over to Clifton. So welcome to our December and final webinar of 2016. Hard to believe we're at the end of the year already, but I know everybody's gearing up for holidays and Christmas schedules. I know those challenges as well. So anyway, this is, for those of you that may not know my voice, I'm Becky Mantle, and I'm Director of the Oklahoma Breastfeeding Resource Center here at the university, and then project lead on our Becoming Baby Friendly in Oklahoma project. And just a few reminders and announcements. Hopefully everyone has seen some of the initial information and registration for our 5th annual summit in February. That will be here on the Health Science Center campus on Friday, February 24th. And we have two wonderful speakers I'm very excited about. Melissa Bartik is a physician, and she has a hot new publication out about the cost impact for breastfeeding or suboptimal breastfeeding on the healthcare systems, and she's been author on a number of publications that you've probably heard me cite her in some presentations. So she will actually be visiting Oklahoma for the first time. And then Cynthia Good-Mojab, who is an IBCLC, but with a strong background in professional counseling. So she will be presenting some as well on kind of communication counseling and a bit on, cultural and cultural perceptions and so forth. And kind of in light of that, we have a couple of panel sessions this year. We haven't ever really done a full mothers panel, so we have a great panel of mothers to share their experiences in various baby-friendly and non-baby-friendly environments. And then we also have a smaller kind of mini panel in the morning that we will hear from some lactation support providers of different ethnicities and kind of give us their observations on the challenges and how they see people interacting with families of color. So we're very excited about that. Then in actually a little earlier in January, I'm doing a 2-day training in Oklahoma City, the location not yet determined, but I do a quarterly 2-day training for health department staff who do home visiting, such as Children First nurses, parents as teachers, and they've just given me the green light to kind of open that up. So if you have any staff that you would like to send to something like that, and there's no charge for that, it's grant funded as well, you can certainly, we will be getting that posted on the Breastfeeding Resource Center website. So, and then lastly, just a reminder about our new online training. If you have questions on that or you want to sign some of your staff up for that, you can contact us as well. And that's the 15-module training that meets the baby-friendly criteria for staff education, at least the 15 hours of didactic education. The hospitals that are enrolled in the Becoming Baby-Friendly in Oklahoma project, there will be a $30 charge for each staff member to enroll, and they have a year to complete that. That gives them access to the university online education portal. And hospitals that are not formally participating or enrolled, there will be a $60 charge. We are also kind of using that as recognition for hospitals that attend the summit as well. So if your hospital sends any staff to the summit, there will be, in BFHI hospitals, will be able to enroll up to 8 staff members in that at no charge. And non-participating hospitals will be able to enroll up to 4 staff to receive some quality free online training. Anyway, so those are kind of all my announcements. I don't want to take up any more time from Clifton, and many of you may remember hearing Clifton at one of our summits a few years ago. I'm trying to remember what year we had you here, Clifton. He was newly married, and he now has a baby on the way. So without further ado, I will turn it over and let Clifton take off. So, and you'll unmute yourself.
So, I'm here, and hello, Oklahoma. I'm glad to talk to you all again. I feel like Oklahoma is my second home in so many ways. So I'm here today to talk about community engagement and what that means. But we are going to ask that everyone mute their phone in the background. Okay. All right. So the echo can be really irritating. And Becky, I think we're going to include you in that muting.
So Clifton, if I mute myself, does that mute you?
Well, if there's an echo that comes in, and I'm trying to figure out if I can fix it.
Okay, okay.
Because it'll affect your recording.
Exactly. So I'm muting myself.
Okay, well, we are going to go ahead and continue to get started. So I want to talk today about the Baby Friendly Hospital Initiative, of course, but I specifically want to talk about community engagement. And the purpose of this is to not go through and tell you if you do A and B, you're going to get C. But rather, this is to talk about some of the ways that you can engage your community, maybe that you haven't thought about, or some ways that might give you some ideas to better engage the stakeholders that utilize your facility. We're going to talk about what community is, and we're going to give some very broad sort of topics and illustrative examples, understanding that the context of every community, every health system, and the people that inhabit both and are employed by both certainly can be different. There is no universal strategy to do this. But I'm particularly interested in this topic because I believe that step 10 of the 10 steps, or the 10 steps to successful breastfeeding is one that doesn't get as much attention as it should, and I believe that there is not a clear consensus on where the responsibility lies in promoting breastfeeding post-hospital. So I do want to acknowledge that I have no conflicts of interest in all of my interactions and collaborations with the Oklahoma breastfeeding organizations, conferences, and so forth have never violated the International Code of Marketing of Breast Milk Substitutes, neither perceived or in actuality. I do acknowledge that these are my opinions and viewpoints. They do not represent any organization or employer that I'm associated with. I'd like to hope that they do, but I certainly only speak for myself in this presentation. So for those of you that don't remember me, that's who I am. That's what I look like. And someone, you know, behind their screen is rolling their eyes like, who cares? Other people are saying, wow. I'm a nurse. I am a researcher. I'm an educator. I'm an IVCLC. As some of you know, I sit on the board for IBLC as well as many other organizations. I'm a breastfeeding advocate. There's my contact if you want to stay in contact with me. And for the first time in my life, I'm going to be a consumer. My family is going to be a consumer of breastfeeding services. So I've grown up in the lactation world. I started taking care of moms and babies as a registered nurse when I was 18. Became a lactation consultant when I was 21. And I'm almost 30 now, and I feel no ways tired in a lot of ways. I see so much more work that needs to be done. So that's who I am. Granted, there's probably many more qualified people that could be giving this presentation, but I'm what you have, and I'm very glad to be here with you. So let's talk about the 10 steps to successful breastfeeding. As you have questions, if you want to type them into the chat box, I am happy to try to address those as we go through the presentation, understanding the constraints of a lunchtime presentation. You may have to jump off or so forth. And at the end, I want to have a conversation more so than just spend all the time going through the slides. So as we know, step 3 of the 10 steps says we need to inform all pregnant women about the benefits and the management of breastfeeding. And step 10 says we need to foster the establishment of breastfeeding support groups and refer mothers to them on discharge from the hospital. So as we think about the community and we think about engaging and intersecting with the community, it's really important that we identify the two steps that directly are affected by community engagement. And I believe that step 3 and step 10 are the two steps that are directly require community engagement, and these steps can only ultimately be fulfilled because we have successful community engagement. So this is a proprietary document. I did not copy the document. What I simply have done is I had the document on my computer and I took a screenshot of it. So, and we'll just leave it at that. This is the guidelines and criteria from Baby Friendly USA. It is available for public consumption. You can download it off their website. But one of the things I wanted to draw our attention to is as we look at the guidelines and the criteria for all facilities, whether you have affiliated prenatal clinics or not, the guidelines say that all facilities should foster the development of or coordinate services with programs that make education about breastfeeding available to pregnant women. Okay? It talks about when the education should begin. And then in the 3.4 guideline, it talks about the things that it should cover. And then it talks about how you're going to be required to do that. So it says that, you know, the nursing director and the manager will need to report that these programs have been fostered, these services have been coordinated. And then it also says that the facility fosters relationship with community-based programs that make these things available. Now, okay, actually I got ahead of myself. Perfect. If you look down, it talks about that 80% of your patients, when you are surveyed and continuing, will need to be able to talk about the information that they've been given. Now, what has happened in the past in many parts of the country is that people have been given pamphlets and people have been given hotlines to call, and that is what we have been considering community support. And perhaps you could pass the survey and you could declare yourself a baby-friendly hospital by doing that. However, I'm here today to say that I do not believe that those things are valid. Now, when we think about step 10, now that we're on this slide, step 10 is about community engagement and about facilitating support groups and facilitating referrals. So when we look at the criteria for evaluation, it says that the nursing director or the manager will report that mothers are given information on where they can find support when they need it after returning home. If you look above that, it says the facility should establish in-house breastfeeding support services if no adequate source of support is available. Okay, that means that you may not just simply pass out a pamphlet that says, this is where you go for the Leche League, or this is where you go for the community breastfeeding support, without verifying that these things exist, without verifying that they're adequate, that they're meeting the needs of the community. And in communities where those things do not exist, by default, it falls to the responsibility of the healthcare organization that's branding themselves as baby-friendly or on the journey to baby-friendly. That means that hospitals are not off the hook for providing continued support, and that falls within the clauses of being a baby-friendly hospital. And that's what we want to talk about today. So, there's excuses and then there is responsibility. So we hear a lot of excuses about breastfeeding support. We hear excuses around this is not our job, we don't have the infrastructure, this is the community's job, the community is saying this is the hospital's job, I'm saying it's everyone's job. But because hospitals are often the backbone and a hallmark in every community, I think where there's not community responsibility being taken, I think the hospital needs to take the lead because the hospital has a vested interest in the long-term health outcomes of the community constituents. So the first thing I want to say is that hospitals do have a responsibility, both by virtue of just being a hospital, but also solidified within the criteria of a baby-friendly hospital. And they need to support and facilitate breastfeeding support both prenatally and postpartum. Like I said, this is not fulfilled by referring individuals to support groups or by giving them pamphlets exclusively. That certainly could be a part of it, but there is greater responsibility that hospitals have in addition to that. Many hospitals exist in places where there are no support groups, or where there are support groups, the infrastructure is very weak. And where this is the case, the hospitals must become. They must become the support group. They must become the infrastructure. So within a hospital, the question then becomes, whose responsibility is this? And I know from the Baby Friendly Hospital Initiative criteria, most of the responsibility for everything falls on the clinical nursing staff. Okay? That being said, I want to encourage us to think about this in a little bit different way. And the way I want us to think about it is that because community engagement encompasses many individuals' responsibility within a hospital or a health system, I believe it's going to be a joint effort, and it's going to be joint between those that work in the hospital, affiliated physician practices, as well as the clinical staff and the outreach and the marketing. So for example, you could have a community engagement or outreach committee that's looking at these issues and facilitating this follow-up support that could include staff from lactation and the maternity units, prenatal clinics. It could include executive staff and administrative staff from marketing all the way up to the C-suite executives, those that are within the hospital auxiliary volunteer services, as well as the departments that cover community outreach. And there's just a meme that says, keep calm, it's not my job. Because when you try to pull these people together, everyone sort of has carved out what their job is. So it's going to take some giving and taking, and approaching this from a joint effort where the responsibilities are shared and it's being framed as community engagement as just opposed to breastfeeding support. We certainly believe that you'll have better buy-in and long-term success. So everyone says community. Support the community. Engage with the community. We need to be in the community. So we need to define what the community is, okay? And everyone needs to do this within their own realm. So what I define my community as in Lancaster County, Pennsylvania is different than what you're going to describe your community in Tahlequah, Oklahoma, or in Norman or Oklahoma City. See? I know so much about Oklahoma, I can call the cities out like I've been there. So, in defining community, there are some questions that you need to ask. The first question is who are your patients and their families? Okay? So, every hospital has populations, and they're not all the same. You know, the population of a large tertiary academic medical center would be very different than, say, the private for-profit medical center that has a community reach and not necessarily a regional or a statewide reach, okay? So you have to know who your patients are. And there's a lot of ways to do this. There are demographic studies that can utilize existing medical record data to disaggregate some key characteristics of your population. And the marketing people in your hospital will know how to do this if they haven't done it already. And in addition to knowing who your patients are, who their families are, where do they live? And I already touched a little bit about different types of health systems, whether it be, you know, the community hospital, a referral center, whether it be a birth center, whether it's part of a larger health system, where there are systems in place to connect patients that access different parts of that health system. And then after you identify who your patients and their families are and where they live, then you identify what breastfeeding support exists in those areas that are serving your patients. And then finally, I know who my patients are, I know where they live, and I know what exists in the communities that they live in. But how do these communities self-identify, and who do they self-identify with? And that's what the rest of this presentation is essentially going to be about. It's going to be about the sub-communities that make up a larger community that must all be tapped into to make community breastfeeding support successful. So here is a very good definition. A community is a group of people. They share the same things. These things include where they work, where they live, where they play, where they practice their faith and their other community values and philanthropic endeavors. But it's also a place where people solve problems together. And to change the culture of breastfeeding and to truly have communities embrace breastfeeding and improve health outcomes, it must be done in a group effort with engagement at many, many, many different levels. Okay, so let's talk about the types of communities. This is not an exhaustive list, but every presentation has limitations, the major limitation always being time. So for the purposes of this presentation, we're going to talk about 4 subsets of communities. We're going to talk about faith-based and tribal communities. We're going to talk about philanthropic communities, business communities, and then virtual communities. So the first one I want to talk about are faith-based and tribal communities. Slightly over 80% of Americans identify themselves with some faith or some faith community. Faith-based entities and faith-based organizations are present in every community, from the most rural communities to the largest metropolitan communities. And faith-based entities tend to be a backbone and a staple, specifically in rural communities. Our tribal and our faith-based entities and communities are going to have a unique platform, and they're going to have a reach that expands beyond the traditional platforms of disseminating information. The level of influence that comes through faith and tribal communities is one that can reach across generations. It's one that can bring a wide variety of people, of families together with a common interest, and one that you can then speak into and a platform to disseminate breastfeeding information, even though the people have not all gathered around that topic. Like I said, there's wide networks to disseminate information. Faith-based organizations have worldwide reach, and the infrastructure and the networks that they have create a unique opportunity to disseminate information around breastfeeding, but also to provide platforms for continued engagement as well as community accountability. There are no organizations within a community that have the level of accountability that faith organizations do. However, it's not as easy as to just say, let's engage the faith-based communities. What often happens is that we go to faith-based communities and we go and we ask and we ask and we ask, but we don't continually engage them. And I find that working with faith-based and tribal communities requires consistency. These organizations don't just want you to come one time in your time of need. They actually want to be engaged throughout. And this means that these organizations must be included in boards, they must be included in committees, and they must be given the opportunity to give opinion in the outputs of what your hospital and your networks are doing to support breastfeeding. So examples could be, I have been a proponent, I have done a lot of speaking, I've helped a lot of faith-based organizations develop what I'm calling parish lactation programs, where a congregation would have internal lactation support that would be delivered from someone that would share the same faith with them. This is also true of having tribal-based lactation programs. Another example would be interdenominational breastfeeding support groups. There is a large push across the nation for interdenominational and interfaith work groups and community initiatives. Hospitals and could potentially facilitate some of these things as an extension to the services provided at the hospital that would essentially place them directly into the community and remove the healthcare system from needing to be directly accessed for lactation support. Like I said, faith-based organizations have a wide network that they can disseminate information, but these places also have space and they have facilities that could host support groups, that could host classes, that would be willing perhaps to let you store things there for your classes if you were doing community support and you had supplies. These could be organizations and entities that really could help you with storage and venues. They might even be willing to provide food and meals, etc. And then finally, these organizations can also help you out with financial sponsorships. And we're going to talk a lot about financial sponsorships, but one of the things that I have known faith-based entities to do in communities where there are where there is not good infrastructure for people to access breast pumps, faith-based organizations have purchased breast pumps as a part of a program that was providing breast pumps to those who could not afford them, as well as faith-based organizations have been willing to sponsor courses and classes for breastfeeding support, as well as in-home lactation support for members of their congregation, very similar to what they would have done for people receiving other medical care. The next group we want to talk about are the civic or the philanthropic organizations. Often when you go into a town, you see Welcome to Norman, and you might see all of these organizations that are present in a town. You have things like the Rotary and the Lions Club and the Boy Scouts and the Girl Scouts and fraternities and sororities and alumni organizations. You have other civic organizations that may rally around a common interest but also have a civic and a philanthropic side. Here in our county, a very prominent civic organization is the Kennel Club, and they have they produce dog shows and so forth, and no one ever thought that they would actually be interested in other things, but when approached about supporting breastfeeding and so forth, they actually had a whole civic arm where they actually did community engagement, and we were able to speak with them about perhaps providing a donation for some breastfeeding support things that we're trying to do here. So how do we engage these civic organizations? Well, first we start with what we have. Most hospitals already have a pathway that they have tried to engage these civic organizations through, whether it be through a yearly donation fund or whether it be through having them invited to committees and boards, being a part of events and seminars. Explore what exists already and then use those things to actually propel your message and to engage them for the desires that you have around breastfeeding. So, doing this would likely require that you ask for an invitation. So you go to your marketing people and you say, we understand that the Lions Club meets here once a month. Could I have 10 minutes at the beginning of the agenda to talk about this and to identify a contact person? So anytime you go to a civic organization and you have a discussion, you always want to identify a person to do follow-up with, and that person now begins to serve as your link between your interests and how that can intersect with their organizational interests and capacity. When we go and talk to civic organizations, the discussions need to be high level. We should not be going to talk to the Lions Club about mastitis or about low supply or any of those clinical issues. We're going to talk with them from a perspective of just broad level support and some things that they can do to gauge their interest and to try to figure out the intersections between their interests and their mission and what we want to do in supporting breastfeeding in the community. Too often, these things are approached in a very passionate way, using guilt or presenting horror stories about failed breastfeeding is not necessarily the approach to take with these. Using just a very simple public health epidemiological approach about the importance of breastfeeding and how the hospital and the community needs them to engage tends to be a more successful strategy. Now, anytime that you are invited to present a longer topic or a longer presentation, it's always important to ask, you know, this is what we could use. Make it very clear how they can help you. So maybe it's financial support that you need. Maybe it's social franchising. And when I talk about social franchising, maybe it's that we would like to be able to put your logo on our breastfeeding support to show the community that you are a supporter of breastfeeding. Or maybe we want a letter of support that comes from you as a community organization saying that we support breastfeeding in the community, we support the hospital in their approach to baby friendly, and we are thereby committed to actually helping improve the community by supporting breastfeeding. Whatever letters you get from organizations, there needs to be a platform for people to be acknowledged. So if your hospital or organization has a monthly award ceremony or any other kind of community engagement, an acknowledgement for their support needs to be done at a public level. So examples is that a civic organization could sponsor food or refreshments for a year. You want to ask for things that are going to be able to be sustainable. So you may talk to your Lions Club and say, well, we have breastfeeding support groups in the evenings, but it's very difficult for mothers that have children because they need to feed their children. Would you be willing to sponsor catering for a year or refreshments for a breastfeeding support group for 1 year? Would you be willing to participate in a pump rental program and purchase a couple of breast pumps that would be utilized for mothers that could not afford one? Are you interested in participating on a committee that's going to work on consistently engaging the community or improving breastfeeding outcomes in the community? And finally, would you be willing to allow us to use your logo on banners and on signs and on printed material that says this organization in the community is supporting breastfeeding and they support the efforts of the hospital to improve and sustain breastfeeding? So philanthropic and civic organizations as well as business have so many things that are common, but there is a difference. Most philanthropic or civic organizations are nonprofit and their goals are not to make profit. Business, on the other hand, we have a goal to make money and to provide a service. So when we talk about engaging with the business sector or with local businesses, the first thing is that hospitals should lead by example. So if we're going to businesses asking them for support, asking them to support breastfeeding, we need to ensure that that infrastructure exists in our hospitals already. So if we're going to businesses and saying, you know, we want you to provide breastfeeding support and we want you to provide breaks for breastfeeding employees, we also need to, in reciprocity, ensure that we are leading by example and that these things are also a clear part of our business model. So often we find in hospitals that administrative and other staff have been yielded to participate in breastfeeding, pumping, and going to rooms and so forth, but sometimes we find that the clinical staff is not yielded those same opportunities. The second thing is that, like before, when we talked about our philanthropic organizations, we also want to intersect with businesses through existing platforms. So if your hospital sits on your local chamber of commerce or so forth like that, that would be a way for you to begin to engage individuals, and that would be a way to build contacts and start conversations. We talked about a specific ask when we're talking about philanthropic organizations. So with businesses and engaging the community, we also want businesses to commit to supporting breastfeeding mothers, not only as visitors to their business, but also as employees. So finally, when we talk about businesses, like I said, hospitals do have the responsibility to facilitate and support these groups, and they have the responsibility to make these linkages happen. That being said, most hospitals don't see that it's in their periphery to work with businesses to support breastfeeding and making sure that businesses are breastfeeding friendly. However, if we read some of the guidelines, the hospitals do have a responsibility for supporting breastfeeding post-discharge. So I think this clearly falls within their periphery. I did want to point out the business case for breastfeeding. It's a tool that was created by collaboration, multiple organizations headed by federal organizations, and it's an online tool that helps communities and businesses create a better breastfeeding infrastructure in the community. There are steps in there for how businesses can create a breastfeeding friendly work site. There's contacts and consultants that can help you, and that's a good starting point for hospitals to sort of think about how to frame these conversations. So illustrative examples of how hospitals have engaged with businesses in the past, we talk about a community-based breastfeeding friendly program, such as what the business case for breastfeeding points to. We also talk about, when we have job fairs in the community, organizations that are breastfeeding friendly or that do support breastfeeding should be able to market themselves in these job fairs as being a organization that supports mothers who are breastfeeding and working. We want businesses to consider sponsoring breastfeeding spaces, both in their workplace as well as in the community. Examples of this include breastfeeding locations at parks where people's children are playing in Little League or Big League, sports events, as well as other community places such as parks, places such as your community airports, train stations, etc. And then finally, I want to talk about online communities. Online communities, this is very valid. Online is not going away, and there are some aggregates of people who do most of their interaction with other people through online platforms. So here's just a couple of examples of some online platforms. I suspect that there will be innumerable platforms that continue to be added every year, but these are some of the basic ones. We talk about Facebook and Twitter, Instagram. I'm not sure if people are using MySpace and those things anymore, but maybe they are. Social media is the largest and the widest used online platform. It's the #1 place that people are going to for information. This allows for a whole different type of community. So this allows for communities that are not geographically restricted. So what can hospitals do? Hospitals can come together in a network and they can endorse an online community, or they can create a social media platform to do breastfeeding support and do breastfeeding follow-up. Or they can go into a network and they can create with other health institutions or with the community a virtual lactation support program that could use social media as a platform. This is especially helpful for hospitals that have very rural communities or transient communities, as well as communities that are mobile. We specifically think about communities where there are significant military families or communities that have larger populations around planting and around harvest, and so forth. Virtual lactation support 3 years ago was still considered to be taboo. I have seen more virtual lactation support programs created in the last year, and I do not think this trend is going to slow down. I think we cannot remove ourselves from virtual lactation support, and I think it's time for hospitals to get on board to provide virtual lactation support for clients that may not have transportation or the ability to return back to the health system for a myriad of reasons. Not to consider that the efficiency, level of effort, and the cost to deliver these things virtually without requiring space and the infrastructure for employees to have dedicated space to run these clinics might actually save money in the long term. So after we've done all these things, we've identified our communities, we have looked at our demographics, we looked at the sub-communities that exist in the larger community, and we've engaged with faith-based and tribal and philanthropic and civic and business, and we've intersected and facilitated online and social media platforms all around community engagement with breastfeeding. What can happen is that we're gung-ho and we do all of these things with a lot of pride and a lot of great intention in the beginning. However, these things have to be kept up and they have to consistently be updated, evaluated, and improved. So I say that we need to establish an award program, and that means that those organizations and entities within the community that have latched on to your vision, those that are helping to accelerate and improve what you're trying to do, they need to be awarded and they need to be acknowledged. And this needs to happen on a yearly basis. So maybe you could create the Community Spotlight Award, or the Outstanding Organization for Maternal Child Health. I wouldn't just make it for breastfeeding because it doesn't have near the reach as naming it something around maternal child health or something around improvements in women and children's lives, or naming it after a person in the community that would have quite a bit of notoriety. And there needs to be a community advisement group. And what this group does, one, it does advise, but even more than that, it provides a way for organizations to have a vested interest. Where you have organizational representatives coming together with purpose, such as on a community advisement group, this by default brings a level of commitment from the organizations that you want to engage, because now these organizations can say, I am sitting on a community board or a community panel to advise the health system on how to support women and their children. And finally, my encouragement is that hospitals and health organizations should build some level of effort for one dedicated person to maintain and be the community representative around these things. It doesn't need to be a full-time position, but perhaps if community engagement could be carved out to be 30 or 45, 50% of someone's time to do these things, that certainly does make it more effective. And I am going to point you all to Becky because she has a lot of experience with working with organizations and carving out LOE around community support and how that can be done, looking at benefits and looking at continued employment and so forth. So to sum this entire presentation up, I want to leave you with a few thoughts. Carrying the title of a baby-friendly hospital comes with significant responsibility. You have marketed yourself to the community that you are committed to breastfeeding and you're committed to improving the health of community and society at large, and thereby actionable items that actually point to and fulfill that declaration that you have made must carry some kind of accountability. This accountability and responsibility is to both the patients and the community at large. That means that breastfeeding support is not specific to just the patients, but within the hospital, supporting your patients and your community spans beyond the hospital, and it spans out across multiple years, up until 2 years from when someone has had a baby, and building this infrastructure for the generations to come and those that will be having babies in latter years is certainly within the manageable interest of the health system that is on the journey to baby-friendly or has received baby-friendly status. Engagement with the community at large, like I said, you have to segment and you have to identify who your community is, and then you have to enlist a strategy. And we've talked about these things. We have to enlist strategies to get into these organizations, to get them vested, to award them and provide recognition. This needs to be consistent. Someone needs to be dedicated to doing it. If the person that's doing it is looking at retirement, someone needs to be following and shadowing with that person to ensure that these relationships continue after the person retires or moves on to a different position. And finally, if you don't forget anything else, if you have no infrastructure within your community to support breastfeeding, that by default now becomes a responsibility of the hospital. You're responsible not only for creating the support structure, but you're also responsible for sustaining it. So that is the end of the presentation that I have. There's 9 minutes left. I did not want to go the full hour. And we certainly want to open it up for questions, but in addition to questions, we also want to hear from what you have done at your organization and what has been successful at engaging the community. So thank you very much.
Thank you for that, Clifton. I've just unmuted myself, and let's see here. I'm going to, oh, you need to probably turn it up. Can you turn it back over to me? And I can unmute people. And while we're working on that, one question I had for the group, because yeah, I was interested when he talked about the businesses and supporting both their employees and then visitors. There we go. Show my screen. I've just got the OBRC website up here. Okay, let me unmute. And that's muted. Come here. Why are we not? All right, I think, have I unmuted everybody? So anybody that wants to ask a question, you may have yourself muted and need to unmute yourself, but I shouldn't have anybody muted from my end. But anyway, we've got several hospitals represented on the webinar today, and I know I was trying to kind of take a stock. I think most everyone has, as a hospital employer, has been recognized through our state recognition program for breastfeeding friendly work sites. So I would ask the group if y'all know, or if your hospital actually promotes that recognition when you're kind of recruiting employees, recruiting new nurses, or at job fairs. That was a point Clifton had on one of his slides that I thought was certainly a good good suggestion to make use of that. So. But other than that, anyone else have questions for Clifton? Got a number of people on the phone, so or on. And
I certainly know the Oklahoma people aren't shy.
Mm-hmm. And another question I would ask the group too is, how many of y'all on your baby-friendly task force have some sort of community representative? That could be a mother that delivered at your hospital, someone else, or other examples from the community, maybe a WIC breastfeeding peer counselor or something. But if anyone has other examples of people, that's certainly strongly recommended to include on your task force. Everybody's going to be quiet today. Oh,
Becky, this is Karen from St. Anthony. Could you hear me?
Yeah, go ahead.
Well, we did have a mother that was on our task force, and she was, she was really helpful to kind of look at things from a different perspective, and I think she gave us some good ideas. She happened to work here at our hospital, but not in OB, so but she was helpful to us. But I do think Clifton gave us a lot of good ideas. I would have never thought to to just use some of the business contacts out there or different civic organizations. So that gave me a lot of good ideas. I really would never have thought to approach those places. So I appreciate those ideas. I really do.
All right, that's great. And notice Karen used the past tense because they are our newest baby-friendly designated hospital. So we will have great delight in recognizing both St. Anthony's here in Oklahoma City and Integris Health Edmond as our newest hospitals at the summit in February. Y'all will get to stand up there and be embarrassed by Dr. Klein. And I see Charlie from Shawnee has also kind of answered my question. She's as far as breastfeeding friendly work sites. She said they give the information and orientation for new employees and the breastfeeding and that they're breastfeeding friendly work site and make sure they know where the employee lactation room is located. So, but yeah, and I thought Clifton, that was a great idea to brag about that or include that in more formal recruitment settings such as job fairs and so forth. Get that conversation going. So, anyone else? And I'm trying to think of any other. I know I had a couple of other reminder announcements. Oh, we do record the webinar, and Kyra is my administrative support is out the rest of this week on vacation, so she will be getting that recording and the online evaluation in the email to y'all, and that will be next week, so be on the lookout. Definitely give us feedback and ideas for topics for next year. We will not actually have a webinar in January as I'm going to be out of town for an extended period of time from about Christmas through Martin Luther King Day, so if you email me, you'll get that response by email, and I will, respond or answer questions and so forth as soon as I can once I'm back. And then just one community support program that we have currently ongoing. Some of you, at least in the Oklahoma City area, would be aware of is our State Breastfeeding Coalition, COBA, the Coalition of Oklahoma Breastfeeding Advocates. Has had some national grant funding, and we have a COBA Baby Cafe in the Oklahoma City area and one in Lawton, and then kind of partnering with Integris Health Edmond for one that they host at their facility. The main one we've had in Oklahoma City is actually moving starting in January and will be actually hosted in the building where the Oklahoma Mother's Milk Bank is. So we think that will be a little better partnership and a better location for our mothers. So I see Clifton had to sign off because he had another meeting coming up here on that.
I'm still here.
Go ahead. Oh, okay. Oh, maybe you were just off of something else. So, okay. Anyway, so we'll be getting information out about that. And I know, I think Cheryl at Hillcrest was on the call there for a bit. Cheryl's a new board member for COBA, and our incoming chair for COBA is Montika Collins, who's in the Tulsa area as well, and they have great interest in seeing if we can launch a baby cafe in the Tulsa area too. So that's definitely a great community support group for mothers that will help address some of the Step 10 responsibilities. So that's all from me, I think. Other questions or comments from anyone? We're almost to the hour, but still have time for another question or two, if anybody has one. All right. Well, I think we will, yeah, call this a wrap. And just remember, you can always check on the website that I have on the screen right now, ouhsc.edu/breastfeeding, and look up previous webinars that have been recorded if you have other staff that wanted, to watch a webinar, or to look up, what trainings are coming up in the area. And of course, we've got the Baby Friendly Summit information right there at the bottom of the home page too. So, all right. Well, thanks to everybody for calling in, and thank you so much, Clifton, for making time for this. And good luck and congrats with the new baby on the way. And give Joanna a hug for us.
Will do. Thank you very much, Oklahoma, and happy holidays, everyone.
All right. Thank you.